You should be able to tell what this lecture is all about without reading the title, but just by looking at the big purple blob on the left side of the screen, because that is most obviously an adrenal gland. So that's the topic of today's discussion. And I will say that that is a human adrenal gland, or at least approximately the shape of, perhaps not the consistency of, a human adrenal gland, but it's actually a pretty close representation of a right adrenal gland in a dog as well. So it pretty much still works for our purposes. Objectives are kind of as you'd expect. You need to be able to recognize what a normal adrenal gland looks like using ultrasound. You should be able to identify various diseases of the adrenal glands using ultrasound, both pituitary-dependent and adrenal-dependent hyperadrenocorticism, other abnormalities like pheochromocytoma, small adrenal glands, and then be able to provide good differential diagnoses for what you see on ultrasound. So when we're looking at adrenal glands and looking for adrenal glands, we're doing that because we want to be able to identify both normal and abnormal morphologies. So ultrasound is really good for doing that because most of the time we can find the adrenal glands and be able to assess them. It's pretty quick to do. Usually you don't need anesthesia. Occasionally you'll need sedation for a patient. But often not, and ultrasound is these days relatively available. So it's a good test to use when you want to assess the adrenal glands. That said, it can be somewhat challenging to evaluate the adrenal glands fully because the adrenal glands are pretty small and their position is not ideal. They're kind of tough to get to. The left one's not so bad, but the right adrenal gland is tucked up under the ribs. There's colon in the way, and so gas can get in the way. Fecal material can shadow, especially in deep-chested dogs where the right adrenal gland's tucked up that much more up under the ribs. So there are some issues that can make life a little difficult when you're trying to assess adrenals. Why would you do adrenal ultrasound? Generally, it's because your physical exam findings or more commonly clinical signs or blood work suggest that there's something going on with the adrenal glands. A lot of times that's evidence of hyperadrenocorticism, but it could be the opposite, hypoadrenocorticism. And then sometimes it's because we've identified some mass that we think might be retroperitoneal and we need to get a better look at it with the concern that it might be coming from an adrenal gland. So here's a critter who has something that's not quite right. And so when I look at the craniodorsal abdomen, I see that there is kind of an oval structure up here that doesn't really fit with what I expect. The splenic head I don't really see, but I know it should be a little bit more cranial, a little bit more triangular. And so this guy has a little bit funny contour, doesn't really match organs I expect. I know that there should be two kidneys, but I can really account for them right there. But I still see this margin right there. And again, I think it kind of goes this away. I'll put a highlight on that. So there's some sort of mass up here, and I'm concerned it's retroperitoneal. It's the right spot for an adrenal gland, so it would be something that I want to assess more fully than I can with radiographs alone. When you're scanning the adrenal glands, as with pretty much everything, you want to use as high a frequency transducer as you can within the limits of what penetration you're going to need to get. So adrenal glands are small, you want to maximize your spatial resolution, thus you want a high frequency transducer. But you do have to recognize that the adrenal glands are also relatively deep within the patient, and so that's going to limit how high a frequency you can use because you're going to need lower frequencies to get the penetration necessary. So you do have to weigh the pluses and minuses. You at least have to be able to image it, so there may be limits as to how high you can go on your frequency. I like to scan my patients for abdomens, pretty much any part of the abdomen in dorsal recumbency. You can use lateral recumbency, but generally it's, for most people, easier to find the adrenal glands with the patient in dorsal recumbency. You're always going to want to image them in two planes, so a sagittal plane and a transverse plane. Most of our classic images are going to come from the sagittal plane, but you also want to image in a second plane just to make sure you don't miss anything. You can image both adrenal glands, but the right one, like I said before, is a little bit more difficult because of its location, and so sometimes it's tougher to get a nice image of the right adrenal gland. And also, like I said before, you may need sedation in a given patient. Again, a lot of times not, but just depends on the critter's temperament. The adrenal glands are located in the retroperitoneal space, just like the kidneys. Both of the adrenal glands are approximately craniomedial to their respective kidneys. The left adrenal gland is kind of definitely cranial to the left kidney. The right adrenal gland is kind of more at the level of the cranial pole of the right adrenal gland most of the time. Both adrenal glands are also just lateral to the respective great vessels on that side. So the left adrenal gland is just lateral to the aorta and usually a little bit ventral. The right adrenal gland is just lateral to the caudal vena cava and sometimes a little bit dorsal as well, although often it's pretty close to lateral. So there you can see on the little schematic up there in the right-hand corner, you can spot where the adrenal glands are and see the landmarks around them that can help you out. I've also used several vessels other than the biggest vessels to identify and find my adrenal glands. The adrenal glands are going to be between the level of the cranial mesenteric artery and the renal artery on that side. So if you can find those two vessels, then you know you're in the right neighborhood for finding the adrenal gland on that side. There's also a phrenacoabdominal artery that runs dorsal to each adrenal gland. We don't usually see that artery on either side, but we often see the phrenacoabdominal vein, which is going to run ventral to each adrenal gland. Usually that's not so much of a landmark because usually you found the adrenal gland before you find the vein there, but it can be another helper sometimes. So to put that in imaging context, on both of these images I have color Doppler on, and the two colorful blotches are the celiac and cranial mesenteric arteries. So the celiac is more cranial, so the left side of the image. Just behind that is the cranial mesenteric artery. And so those are the two vessels as they come off the aorta, and you can see just caudal to those big vessels is the left adrenal gland. So they do make for a good landmark. If you can find them, you should be able to then find the left adrenal gland. There that is. A little bit different plane, but kind of the same sort of image. Now we've got the aorta a little bit more fully in plane. You can see the celiac artery coming off, the cranial mesenteric artery coming off, and on this last image, the renal artery on the left side is just out of the coming in and out of the plane up there. So we'll put some labels on that, and then you can see that the adrenal gland again sits between the level of the cranial mesenteric artery and this is the renal vein in this case. The artery is a lot smaller than that. I think I misspoke earlier, but again, you can see with the vessel where the vessels are, and the left adrenal gland is kind of nestled in amongst all those. As I noted, phrenacoabdominal vein is visible once you find the adrenal gland. So you've got B mode on the left, add color Doppler on the right. You can see you've got some color flow in that vessel. You've got it in cross section. So here we see that nice vein immediately ventral to the adrenal gland. The phrenacoabdominal artery would be just dorsal to the adrenal gland. I'm not really seeing it in this case. So how do we go about finding the adrenal gland in real life? Basically, my technique usually is to find the kidney first. So in this case, I've got left adrenal gland I'm looking for, so I'm going to find the left kidney, kind of get it roughly in the middle of the screen, and I'm going to push a little bit downward, kind of give a little bit of pressure, and scoop or fan my probe, my transducer, immediately until I get to the aorta. Hopefully I found the adrenal gland in that. If I don't and I get to the aorta, I'm going to slide back just a little bit, just fan back a little bit laterally until I do find the adrenal. So here we go. Here I'm going to show a little video. So there we've got kidney in the middle of the image. I'm going to fan my probe medially, and there it is. There's the adrenal gland coming in. There's some big vessels there. That should be the aorta. Again, kidney with some mineral in it. Fan medially just a little, not too fast, or else we're going to zoom right past it. But there's the adrenal gland. You can see the phrenacoabdominal vein just above it, just ventral to it on the image right there, and then the aorta just deep to it. So that's really all it takes. It's that easy. It's not really that easy, but it is not too bad, especially if you have a cooperative patient. The normal adrenal gland in a dog is very similar to the adrenal gland in a cat. I did break them out because there are a couple little differences that I'll highlight, but a lot of these general appearances are pretty similar between the two species. Adrenal glands are usually fairly uniformly hypoechoic to the surrounding fat. You may see a hyperechoic line representing the junction between the cortex and the medullary portion of the gland. The adrenal glands are small, they're kind of elongated, usually kind of ovals, but the shape does vary a little bit. The left adrenal gland may be anything from a skinny oval to a kind of a peanut shape. The right adrenal gland sometimes will also look like a skinny oval. If you could catch it fully, it would look more like a boomerang or an arrowhead, but a lot of times that kind of angled part of the adrenal gland is out of the plane when you're getting the caudal part of the adrenal gland on the right, so it's hard to really appreciate the full shape of it on ultrasound. So looking at normal echogenicity, you can see hypoechoic to the surroundings, usually pretty uniform like it is in these two cases. There it is outlined. Again, you can have a little bit of variation to the echogenicity. So on the left image, you've got those little parallel hyperechoic stripes representing the demarcation between cortex and medulla. On the right side, I'm going to ditch the lines for a minute here. You can see there's a little bit of increased echogenicity centrally there, representing the medullary portion of the gland. Again, that is a normal variant, so not really exciting. That is just one of those possible findings in normal patients. Shape of the left is usually relatively constant, not as much variation in shape as we'll see on the right side. So you can see it's usually kind of somewhere between peanut shaped and then just long and skinny. On the right side, again, a little bit more variation. You can have some that are a little longer, some that are a bit more arrowhead shaped. Again, like I said before, the ones that are long, usually there's a portion of the cranial pole that's kind of coming out of the plane in the other dimension, so we don't really appreciate it. And so if you could get the perfect image, most of these would look kind of arrowhead shaped, but again, we usually just have a hard time catching that full appearance on ultrasound. As far as size goes, there's a bit of a range in what one can expect in a dog, and the initial study was from a good while ago now, 1995, looking at ultrasound appearance of dog adrenal glands, normal dog adrenal glands. One thing they found that has held true over time is that measuring length is not very useful because there's an incredibly diverse number of range of lengths that you can see in dogs, and it's not very helpful for identifying what's normal and what's abnormal. So what they did find was that diameter was a little bit more useful, a little bit more constant for measuring. And this first study found that there wasn't a very good correlation between body size and diameter either, and so they postulated that, well, it doesn't really matter what size the dog is, we can just create a cutoff for what the adrenal size should be. And they said 7.5, 7.4 millimeters was a good cutoff for identifying an enlarged adrenal gland. So everything 7.4 and less was okay. If it was bigger than 7.4 millimeters, it was too big. The problem is, it wasn't a very useful cutoff because about a quarter of dogs who had pituitary-dependent hyperadrenocorticism had normal-sized adrenal glands by that cutoff, and up to a fifth of dogs who had no adrenal disease would have been called to have enlarged adrenal glands because they would have been bigger than that supposed cutoff. So it wasn't the most useful set of numbers that we had. Thus, and because a lot more people needed tenure, more studies were done. And these studies fortunately found, I say fortunately because I think it's true, found that size does matter. If you're a little dog, your adrenal glands should probably be smaller than the adrenal glands in a big dog. A toy poodle should not have the same size adrenal glands as a mastiff, which that first study said, all dogs are the same. But now we have several studies that show, you know what, if you're a dog who's less than 10, 12 kilograms, a 7 or 8 millimeter adrenal gland is not okay. And you can see there's a little bit of variation in the thickness here, but by and large, a little dog should have an adrenal gland that's 6 millimeters or less. And that seems to hold up with our clinical experience as well. So that's kind of where we go now, is if you're a bigger dog, 7 or 8 millimeters is probably going to be your cutoff, but a little dog, again, 10, 12 kilograms, 5.5 to 6 millimeters is going to be your upper cutoff. And if you have an adrenal gland bigger than that, then we're starting to talk about abnormalities. So there you go. The image on the left, going to be a normal adrenal gland no matter who you look at, 4.5 millimeters. No worries there. The one on the right, 8.7 millimeters between the calipers there. And so that's probably too big, especially if it's a little dog. But even if it's a big dog, it's kind of towing the line at best. So it's possible that this isn't abnormal. It's possible it's a stress response or something, but you do need to correlate it with clinical signs, with your lab work and everything. And there's a good chance that this guy's going down the enlarged path toward hyperadrenocorticism. So what about a cat? Again, like I said, imaging appearance of the adrenal glands is pretty similar, cats to dogs. So the adrenal glands are hypoechoic. Usually in a cat it's uniform. We don't usually see those little striations or stripes like we can in dogs. Occasionally we will see little mineral foci in cats. So older cats, up to about a third of them, will have little hyperechoic foci representing mineralization, and that's a normal change in a cat. We don't see that or expect to see that in a normal dog, but we will in normal older cats. They generally have kind of rounder, oval adrenal glands. They're not really peanut shaped. They're not quite as elongated as in a dog. And they generally a little bit more cranial to the kidneys than a dog's adrenal glands are, with the right adrenal gland often snuggled up against the liver, and the left adrenal gland not quite as close to the cranial pole as the left kidney, as you would expect in a dog. So a little less variation in appearance of adrenal glands size-wise, all fairly similar looking little ovals there. And like I mentioned, sometimes you'll see in older cats little hyperechoic foci. Again, normal mineralization, not too exciting there. We certainly need to know how big the adrenals are in a cat as well. Several studies were done. Again, more people needed tenure, so we got a lot of studies, or at least several studies. And the good news here is that the measures tended to be a little tighter, which probably helps that most cats are about the same size as each other too, compared to dogs. But again, length wasn't nearly as useful, so we kind of ignore that. But if you look at the widths for diameter, height, width, they all called it something different. But looking at that transverse measurement, all of those are going to be kind of in the same ballpark, somewhere in that 3 to 5 millimeter range. And so that's really what I consider normal for a cat. I really don't want to see a cat more than 5 millimeters for its adrenal gland. Once it gets bigger than that, then I'd be concerned again that it was too large and there's something going on. So that's so lots of numbers. There's your too long, didn't read, 3 to 5 millimeters. Next slide. So if the adrenal glands are too big, what are we talking about? Well, they're diffusely too big. It's probably, if you have to choose a disease, pituitary-dependent hyperadrenocorticism. So that disease, you've got a pituitary lesion that's hyperstimulating the adrenal glands to produce all those things they produce. You're going to expect the adrenal glands to be uniformly enlarged. So not a discrete mass, just general enlargement of the adrenal glands. Usually it's bilaterally symmetric, so usually both adrenal glands are affected, but occasionally we will see unilateral involvement, or at least asymmetric involvement of the two adrenal glands. And occasionally they're sonographically normal. So you can certainly have a dog or cat with hyperadrenocorticism that doesn't have sonographically apparent adrenal disease, but that's a rarity, I would say. Occasionally we'll see nodules in these pituitary-dependent cases, but that's also uncommon. Ultimately, of course, you're going to have to correlate your imaging findings with all the other lab work and clinical signs. So really, no matter the size of this dog, these adrenal glands are too big. If you look at the transverse measurements, the one for the left adrenal gland is basically 2 centimeters. The one on the right is plump enough. It's 12 millimeters, 1.2 centimeters. So both of those are too big. They're fairly uniformly involved. There's no discrete mass here, and it's bilateral. So those would be pretty compelling for pituitary-dependent hyperadrenocorticism. Another case, this is a Shih Tzu. You're looking at the measurements of the cranial pole on both of these, left adrenal gland, right adrenal gland, 10 millimeters, 9.1 millimeters. Even for a big dog, that would be kind of pushing it for size. It's probably getting too big. Certainly for a small dog, those are definitely too big. So again, uniform involvement and bilateral. So this was pituitary-dependent Cushing's. Cats will get it too. Hyperadrenocorticism is not nearly as common in cats as it is in dogs, but we will see it. And this is a case, again, a pituitary-dependent case where if you look at the measures of thickness, number 2 and number 4 there, 8 millimeters, 7 millimeters, that's too big for a cat. Again, it's uniform, it's bilateral, so this is a pituitary-dependent hyperadrenocorticism. If it's not the pituitary's fault and it's an adrenal gland's fault for hyperadrenocorticism, then we would expect to see a specific problem with usually one, not both, adrenal glands, and usually it's a mass. There could be some shape change, but usually you're going to find a discrete mass. And that mass could extend from the entirety of the adrenal gland, maybe just part of it. Echogenicity can be variable. It may or may not be mineralized, but it should be some sort of discrete, asymmetric, irregular mass coming from an adrenal gland. almost always unilateral. Theoretically, you can have bilateral disease if both of them had masses on them, but really it should be a unilateral disease. And because there is over suppression or over secretion of the very cortisol, etc., the other adrenal gland should be normal or small because the hypothalamic pituitary adrenal axis should be suppressed. So the normal adrenal gland will be atrophied and small, where the affected one has a mass coming off of it. And these masses may be adenomas or adenocarcinomas, which you can't always tell the difference in sonographically. When you're ultrasounding these guys, you do need to evaluate for local extension. Is there invasion of the caudal vena cava? Is there invasion of that phrenico-abdominal vein? And you're also going to assess the area and a whole abdomen for evidence of metastasis, either carcinomatosis, mets to the liver, anything like that. This was a case of an adrenocortical carcinoma, and what we can see is there are actually nodules in each pole of the adrenal gland. We got two images, slightly different, but same adrenal gland. So there's kind of this slightly hyperechoic nodule in the caudal pole and this almost isoechoic nodule in the cranial pole. And there are actually cavitations in both of those nodules. We don't usually see cavitations in benign things. I've said before, there are exceptions to that rule, but we often do not see cavitations except in malignancy. So when I see cavitations, that's my concern, is that these are carcinoma, not just adenoma. More of the same. Now we have an area of shadowing, so you can see a hyperechoic band. I've got a big shadow coming off of it, so there's evidence of mineralization. A few little foci of mineral in a cat is okay. A big block of mineral is not okay, especially in a dog. So this would also fit with something malignant that has mineralized. Again, fits with adrenocortical carcinoma. Another case, kind of similar story. Here we've got evidence of invasion. So here we have this big adrenal mass as this kind of medium echogenicity oval, and then right where the phrenico-abdominal vein lives, marked by the calipers there, there's a little circle. It looks like it's not anechoic like I would expect blood to be, so there's evidence that it could just be a blood clot because it's compressed, but there's a high probability that that vein is invaded by this mass. There's our mass again. And there again, it could be thrombosis, but I would be concerned about invasion. And then same case, looking at the caudal vena cava. Here's normal caudal vena cava on the caudal side of this left image, anechoic like it's supposed to be. And you can see this very echogenic, round-margined, sharply marginated structure occupying the entire lumen of most of that cava. Could be a clot, sure, but I think most likely that this is going to be invasion by the tumor. We put color flow on it, and we can see there's some blood trying to get around and through this thing, but it's having a hard time, so not great blood flow through the caudal vena cava. Another particularly aggressive lesion of adrenal glands is pheochromocytoma. So that's a neoplasm of the medullary portion of the adrenal gland. We see a number of them incidentally and not with specific clinical signs, but they certainly can have clinical signs of tachycardia, hypertension, because these tumors are secreting epinephrine and or norepinephrine. These will look similar to carcinomas of the adrenal glands because you've got a well-defined mass or shape change, just like with the carcinoma, the adrenal-dependent Cushing's. Echogenicity is variable. Again, it should be unilateral. It's unlikely that you're going to have a pheo in both adrenal glands, so generally we see one adrenal gland affected. These are pretty aggressive, even more commonly than the adrenal cortical tumors. So they're often invading vessels, they're often metastatic, but at the end of the day, you really can't differentiate these from adenomas or adenocarcinomas, especially adenocarcinomas with the invasion side, with ultrasound. You're going to need other means, which usually means taking the adrenal gland out with surgery. So here you go. I've got on these images, kidney is kind of at the top of the image, on the right here, on the left here. You've got this gigantic mass. It's retroperitoneal, but it's distorting so much, it's actually hard to see exactly where it's coming from. We found that it was compressing the kidney, but it really didn't look like it was extending from the kidney. It was just cranial to the kidney, so it certainly fit with an adrenal mass. It was giant. It was at least compressing the venal cava, if not invading. There were cavitations in it. Again, highly concerning for something malignant. Pheochromocytoma would be on your list. Still can't rule out a carcinoma, but either way, probably something malignant. And they don't have to be nearly as big. Another case, this one, is bilateral actually, which I said was not very common, but it can happen. Because these were bilateral, we thought maybe these would end up being incidental benign nodules like adenomas, but these were ultimately found to be pheochromocytomas, both of them. So it's certainly not impossible to have bilateral disease, even with something more focal like a pheochromocytoma. We do see incidental nodules with some frequency in the adrenal glands, often referred to as incidentalomas, if we have no reason to believe or expect that they were going to be there, so no evidence of hyperadrenocorticism, no high blood pressure, tachycardia, anything like that. They still could be malignant, so you could just have an early pheochromocytoma, an early carcinoma, but a lot of times we'll see nodular hyperplasia or incidental adenomas. So there's a list of differentials to consider, and you don't even have to have a single one. You could have multiple different ones in the same gland, so you have to keep your mind open and your differential list open when we see these. Because they can be any number of things, shape varies, echogenicity varies. If they start invading nearby structures, you can be pretty confident they're malignant, whatever they are. If they're not invading structures, they still could be malignant, but they may be benign. Again, we talk about size being important, so the larger the mass is, the more likely it is to be malignant. So if you have an adrenal mass greater than 4 centimeters, it's pretty certainly to be malignant neoplasia. That's a big mass, so it's not too surprising. If you're in the 2 to 4 centimeter camp, you're still highly concerned that this is malignancy, and if it's less than 2 centimeters, it could be benign or malignant, although in reality, even once you get to 2 centimeters, that's getting pretty chunky, and so you have to be a little concerned. But yeah, really, once you get above 2 centimeters, high concern for cancer. Above 4 centimeters, it's pretty much a guarantee. So what do we do when we find an incidental nodule? Well, you can sample it, but that's not what a lot of people want to do because you don't want to make pheochromocytoma angry. So a lot of times we just recheck in some number of months. And that's what we did in this case on the left. We have a hyperechoic nodule in the cranial pole of the left adrenal gland. We weren't expecting it. The dog had no signs that would be associated with that. We rechecked it several times over the next number of months. It didn't change at all, so we presumed it was some sort of benign nodule, such as an adenoma. Similar case, this time the caudal pole, mildly hyperechoic nodule. It was unexpected. We don't know what it is. There's a good chance it's benign, but no guarantees. And again, that would be something you'd want to recheck at some point in the future to see if it was changing. Certainly you can have more complex nodules. This was one in the caudal pole of a dog. You can see it's hyperechoic, but it's got kind of a hypoechoic, almost cavitary area centrally. That cavitation makes us concerned that it might be malignant, but end of the day, we don't know, and you'd want to follow up or resect it. Pretty invasive to go resecting it, so it just depends on how aggressive the owners want to be. If they just want to recheck it with ultrasound in a couple months, see what it looks like then. Other side of the spectrum, what about small adrenal glands? A couple options. Hypoadrenocorticism, so Addison's disease would be one thought. Iatrogenic Addison's would be another, so exogenous corticosteroid administration is going to affect the whole hypothalamic pituitary adrenal axis and cause atrophy of the glands, so that would be another reason to have small adrenal glands. And depending on how small they are, they could be normal for a given patient. We know that it has been found that dogs with hypoadrenocorticism do have smaller adrenal glands than normal dogs do, but that's pretty subjective, and there's actually not really an established lower limit for how small is still okay for an adrenal gland. So it is a bit subjective when you start saying that an adrenal gland might be too small for a given patient. Now, that said, if they're so small you can't even find them or have a hard time finding them, that's a concern. So the image on the left is a Labrador Retriever. I've put calipers on the adrenal gland. I'm going to put color on it. There it is. A little sliver is 1.7 millimeters in thickness. That is tiny. That is absolutely tiny. It's hard for me to believe that that is okay for a big dog like a lab. So that's pretty compellingly small, and thus I would be concerned about Addison's disease unless the patient had been receiving corticosteroids exogenously. Same story for the dachshund on the right. It's a small dog, but that's a small adrenal gland, so I'd also be concerned about hypoadrenocorticism there. More of the same, German Shepherd dog. It's a big dog. Those aren't the tiniest adrenals ever, because I just showed you the tiniest ones on the previous slide, but that's still pretty scrawny for a German Shepherd, and so you have to kind of put the clinical picture together and decide, do I think these are too small for this dog? Maybe. Does it fit with his clinical signs? Does he have signs of Addison's disease or not? And decide what sort of further testing you want to do. We rarely sample adrenal glands in veterinary medicine. It is done in human medicine with low complication rates, but usually we're not doing it. I think people have enough concern that if the nodule in question is a pheochromocytoma, we're going to cause big problems, then they tend to kind of shy away. So it can be done, but it's not routine by any stretch of the imagination. It's almost never done, so I won't spend much time there. So that brings us to the end of adrenal glands. As with a number of other organs, ultrasound is good for finding adrenal nodules, good for finding adrenal masses, even enlargement, but it's not the greatest at distinguishing what different masses are. Ultimately, you've got good sensitivity, but only moderate specificity for diseases.